Hello, my dear budding doctors. I welcome you all to my YouTube channel, Medicos Notes. So, today we are starting a new series again, which is the important short answers of lower limb. I have covered the important short answers in upper limb. It will be in our YouTube channel. You can go and check it out. It will be very useful for you. This series also covers two parts. Each part will have a set of 5 questions. So, altogether, this 10 questions will now you will cover almost the important short answers which has been asked frequently in our board exams. Okay, so moving on to the video. The first question is the constituents of quadriceps femoris. So quadriceps femoris, as you all know, it is a large muscle group which is situated in the front of thigh. These are the anterior group of muscles of thigh. Okay, so quadriceps femoris, it actually contains a set of 4 individual muscles. Okay, so the 4 individual muscles are rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. So see, you can see this diagram here. This is the rectus femoris muscle. Okay, so beneath the rectus femoris you can see the vastus intermedius. See here, vastus intermedius is given here. Then towards the lateral side you can see the vastus lateralis, and towards the medial side you can see the vastus medialis. So these 4 muscles altogether, they are known as quadriceps femoris. Okay, so the important function, the important action of these muscles are they are the most powerful extensors of knee. So the extension of knee joint is the important action of quadriceps femoris. Okay, now moving on to the next question. Popliteus muscle. So if they have asked about a muscle in 2 mark question, you have to write the origin, you have to write the insertion, you have to write the innervation, blood supply, nerve supply, and you should also write the action of the muscle. Okay, so these 5 points is important for any muscle that's been asked. Okay, now we'll see about the popliteus muscle. So origin is in the lateral femoral condyle on the outer margin of lateral meniscus of knee joint. So as you can see in this diagram, the posterior view is given here, and the origin is not seen properly, but as you can see, this is the femur, and the lateral femoral condyle, the origin of popliteus muscles is there. Okay, now insertion. So insertion, this is the tibia, this is the fibula. Okay, and this is the posterior surface of tibia, and this is the shaft of tibia. So where is the insertion? As you all know, the insertion is in the posterior surface of shaft of tibia. Okay, now the blood supply. The blood supply of popliteus muscle is, as we all know, it is a popliteal artery. Branches of popliteal artery provide blood supply to popliteus muscle. Okay, now the nerve supply. The nerve supply of popliteus muscle is tibial nerve. Now the action. So this is the most important thing. So the action of popliteus muscle is unlock knee joint prior to flexion. So prior to the flexion of knee joint, the unlocking of knee joint is performed by the popliteus muscle. Okay, so that's it for this question. So these 5 points are very important for any 2 mark about a muscle. Okay, now moving on to the next question. Hamstring muscles. So as we all know, where are the hamstring muscle located? In the back of thigh. In front of thigh, what was the muscle we saw just now? Quadriceps femoris. Okay, now hamstring muscle. Hamstring muscles run down the back of thigh. Okay, and these are 3 hamstring muscles. So hamstring muscle is actually a combination of 3 individual muscle. Okay, so they are semitendinosus, semimembranosus, and biceps femoris. So as you can see in this diagram, this is the biceps femoris. This is the bulky muscle, is the biceps femoris. This is the semitendinosus, and this is the semimembranosus. Okay, now we can see the individual description of each muscle. Semitendinosus. So as you can see, this is the semitendinosus muscle. Okay, so origin is in the, what is this? This is the ischial tuberosity of hip bone. So the origin is in the inframedial impression of ischial tuberosity. So inframedial impression of ischial tuberosity. Insertion into the upper part of tibia behind sartorius and gracilis. So sartorius and gracilis are 2 muscles. Behind sartorius and gracilis, the semitendinosus is inserted. So insertion in the upper part of tibia. So this is tibia, this is fibula. So here in upper part of tibia, semitendinosus is inserted. Okay, now the nerve supply. Nerve supply is by, we all know it is by the tibial nerve. Okay, so tibial part of sciatic nerve provides the nerve supply to semitendinosus muscle. Now action, very important one. Please note, the important action of hamstring muscles are they are the chief flexors of knee. Okay, so this is the semimembranous. See this diagram, this is the semimembranosus muscle. Okay, Now the origin is in the upper part of ischial tuberosity. So as you can see here, this is ischial tuberosity. In the upper part of ischial tuberosity, the semimembranous originates. Okay. Now the insertion. You can see here where it is inserted into the tibia. Okay. Now insertion into the horizontal groove on the posteromedial surface of medial tibial condyle. So this is the medial tibial condyle and it is inserted into the posteromedial surface of medial tibial condyle. Okay. Now the nerve supply, same tibial nerve. Okay, that is the tibial part of sciatic nerve. Okay. Now the action, as we all know, they are the chief flexors of knee. Okay. Now moving on to the third muscle, that is the biceps femoris. So biceps femoris, it has two heads. Okay, short head and long head. So this is the long head. You can see here, this is the long head and this is the short head. Okay. So the long head, as we all know, it originates in the late. Can you see here? Okay, now this is the long head. It originates in the ischial tuberosity, upper part of ischial tuberosity. So see here, from the infromedial impression on the upper part of ischial tuberosity. Now insertion. See here, this is the head of long head of biceps femoris where it is inserted into the fibula, head of fibula. Okay, so insertion in the head of fibula. Nerve supply, same as we have seen before, tibial part of sciatic nerve provides the nerve supply to the long head of biceps femoris. Okay, then action is they are the chief flexors of knee. Now the short head of biceps femoris. So can you see here, this is a short head of biceps femoris. Okay, so the origin is the from the lower half of lateral lip of linea aspera. So this linea aspera is a longitudinal ridge in posterior aspect of femur. Okay, so this is the femur, this is the femur, and in the posterior aspect of femur there is a longitudinal ridge and that ridge is known as linea aspera. So the short head of biceps or biceps femoris originates from linea aspera. Okay, now insertion, same as before, it inserts into the head of fibula. Now the nerve supply. So the nerve supply of biceps, short head of biceps femoris is a bit different. It is by the common peroneal nerve. Okay, which is a division of sciatic nerve. So common peroneal part of sciatic nerve provides the nerve supply to biceps femoris. Now the action. Action, we all know they are the chief flexors of knee. So that's it for this hamstring muscles. So it is a very important question, very repeatedly asked question, frequently asked question. So please note. Okay. Now moving on to the fourth question. Okay, so deep peroneal nerve. We all know deep peroneal nerve. So deep peroneal nerve originates from common peroneal nerve. Okay, super. Now, the deep peroneal nerve, also known as deep fibular nerve. So, this deep fibular nerve is an old name of deep peroneal nerve. Okay, so is one of the two terminal branches of common peroneal nerve. Can you see here? This is the common peroneal nerve, and the two branches are superficial peroneal nerve, and this is the deep peroneal nerve. Now, origin, the terminal branch of common peroneal nerve in the lateral compartment of leg. As we all know, it originates from the common peroneal nerve in the anterior lateral compartment. This is the lateral side. Okay, this is the medial side, this is the lateral side. So in the lateral compartment of leg, this originates from the terminal branch of common peroneal nerve. Okay, now course, it is given that it passes into the anterior compartment of leg where it courses inferiorly into the dorsal aspect of foot. So as you can see here, it passes through the anterior compartment of leg and then it passes to the dorsal aspect of foot. Okay, so this is the course of deep peroneal nerve. Now the motor supply. So this deep peroneal nerve provides both motor supply and sensory supply. Okay, so the motor supply is provided to the anterior compartment of leg and the sensory supply is provided to the dorsal aspect of foot. Okay, now moving on to the next question, triceps surae. This is also a very important question that's been asked frequently, and it is a important muscle that we need to remember. Okay, so triceps surae is a three-headed muscle in the posterior compartment of leg. Okay, so as you can see in this diagram, this is the leg, this is a posterior view. So in posterior compartment of leg, this muscle is there, that is triceps surae. Okay, so triceps surae is actually a combination of two muscles, which is the gastrocnemius and soleus. So this is the soleus muscle, this bulky muscle is soleus, and this is the gastrocnemius. So gastrocnemius actually has two heads. Okay, lateral head and medial head. So what is the important function of triceps surae? plantar flexion of foot. So the main function of triceps surae is to plantar flex the foot. Okay. So in addition, gastrocnemius also aids in flexion of leg. So gastrocnemius also aids in flexion of leg, and soleus also aids in maintaining a steady posture while standing on the ground. Okay. Now we can see the individual description of these muscles. So origin, gastrocnemius in lateral head and medial head. So lateral head is from the posterolateral surface of lateral femoral condyle, and medial head and posterior surface of medial femoral condyle. So you can see here, this is the gastrocnemius, this is the soleus. So for this is the gastrocnemius, and these are the two individual heads of gastrocnemius muscle. So this is the medial side, this is the lateral side. Okay. So medial is from the medial femoral condyle, posterior surface of medial femoral condyle, and the lateral head is in the posterolateral surface of lateral femoral condyle. Okay. Now where is it inserted? In gastrocnemius is inserted in the posterior surface of calcaneus. So you can see here, it is inserted in the posterior surface of calcaneus. This is a calcaneus bone, and posterior surface of calcaneus it is inserted. Then the innervation. So tibial nerve provides the nerve supply to the gastrocnemius muscle, and blood supply is provided by the posterior tibial artery. Okay. So as you know, the function of gastrocnemius muscle is the plantar flexion of foot. Okay. Now for soleus, soleus is inserted in the, it originates in the medial border of tibia, head of fibula, and posterior border of fibula. Okay. So from tibia and fibula altogether it originates, and it is inserted in, same as we know, posterior surface of calcaneus. So can you see here, it is also inserted in the posterior surface of calcaneus. Okay. And it originates in the, yes, super, in head of fibula, posterior border of fibula, and medial border of tibia. Okay, super. Now innervation, as we all know, nerve supply is by the tibial nerve, same as gastrocnemius. Okay, and blood supply is also same as gastrocnemius, which is the posterior tibial artery. And the function we saw before, that is the plantar flexion of foot. Okay. Okay, so that is for triceps surae. So I have to remember these questions. These 5 questions are very frequently asked questions, which are the most important questions. So that's it for this video. We have covered altogether 5 questions. 5 more questions will be coming in part 2. So keep supporting. If you have any suggestions, you can write down us in the comment box below. So thank you for listening patiently. Thank you, doctors.